With me today is a clinical psychologist and lecturer at College of Medicine, Dr. Erick Omar, joining me on a topic of depression. Thanks for joining me, Erick.
No, thank you for having me.
So we know that depression affects thousands of people in Malawi. It knows, as I said, it knows no color, it knows no age, and we want to highlight more on this topic. And, because I think it's something that maybe is, it's a stigma amongst Malawians. What can you say about depression in this nation? Is it something that we take seriously or as a nation?
I think it's, like you're rightly putting it, it's a very important issue, it's an important topic. In fact, we should say that in terms of when we're taking depression and then looking at it from a broader context, so putting it in that space of mental health. Mental health is one of the areas that is neglected in Malawi. Now, going down to like the issue that we're looking at, depression, it's one of those actual conditions that affect so many people. We don't have some kind of epidemiological kind of data because very little kind of research is being conducted. But I would say that based on some studies that we've conducted, especially among mothers, we find that probably around 20% of mothers, and then we could even extend that to the general population, somehow are really kind of suffering from depression and having those kind of major kind of effects on their life or day-to-day life.
So I feel like in rural areas, as you're saying, a lot of people are affected, but most people don't know the right steps to take when it comes to depression. Some people don't even know what it is. So can you, because like sometimes I can be sad, am I depressed? Or what is depression? Can you break that down to us?
Yeah, so you're right. It could be that people are actually suffering from depression, but they don't actually know that this is really depression. So that's what I think, like you're saying. So first and foremost, depression represents any kind of situation where an individual is persistently experiencing some kind of a low mood. So sadness. Now that kind of sadness that maybe you can't even explain where it is coming from. And this should be, let's say, maybe for a period of more than 2 weeks. But then there's that kind of persistent low mood. Okay, you're feeling sad.
Yeah.
And at the same time, it should be where you're actually losing interest in the activities of daily life. Okay, so those two things are really important. Now, because you're constantly or persistently sad, at the same time, because you've lost kind of interest in daily kind of activities, those two elements would actually produce a number of symptoms, both in terms of behavior and even in terms of the way that you would relate to people and things like that. So some of the major symptoms of depression would be where you actually, let's say your appetite would be affected. So you don't enjoy food anymore. Things that you enjoyed every single day or every time you're doing it, you find that you no longer enjoy it. Then you also have things like sleep. Your sleep is disturbed. So insomnia, where you fail to go to sleep at night. Or maybe by 2 a.m. or 1 a.m. you're already awake and you'll be tossing and turning until, let's say, morning. And when it is now a bit more serious or severe, that's where issues around suicide come in, like you really wanting to hurt yourself.
Speaking of suicide and depression being such a stigma in Malawi, let's watch a clip that will give us an insight on depression and how it affects people all over Africa. Take a look.
Growing up in West Africa, when people used the term mental, what came to mind was a madman with dirty, dreadlocked hair, bumbling around half naked on the streets. We all know this man. Our parents warned us about him. Mommy, why is he mad? Drugs. If you even look at drugs, you end up like him. Come down with pneumonia, and your mother will rush you to the nearest hospital for medical treatment. But dare to declare depression, and your local pastor will be driving out demons and blaming witches in your village. According to the World Health Organization, mental health is about being able to cope with the normal stresses of life, to work productively and fruitfully, and to be able to make a contribution to your community. Mental health includes our emotional, psychological, and our social well-being. Globally, 75% of all mental illness cases can be found in low-income countries. The stigma is personal. In 2009, I received a frantic call in the middle of the night. My best friend in the world, a brilliant, philosophical, charming, hip young man, was diagnosed with schizophrenia. I witnessed some of the friends we'd grown up with recoil. I heard the snickers. I heard the whispers. Did you hear he has gone mad? He started talking derogatory, demeaning commentary about his condition, words we would never say about someone with cancer or someone with malaria. Somehow, when it comes to mental illness, our ignorance eviscerates all empathy. I stood by his side as his community isolated him, but our love never wavered. But we Africans especially need to realize that our mental struggles do not detract from our virility, nor does our trauma taint our strength. We need to see mental health as important as physical health. We need to stop suffering in silence. We must stop stigmatizing disease and traumatizing the afflicted. Talk to your friends. Talk to your loved ones. Talk to health professionals. Be vulnerable. Do so with the confidence that you are not alone. Speak up if you are struggling. Being honest about how we feel does not make us weak. It makes us human. It is time to end the stigma associated with mental illness.
So that clip was on this young man talking about how it's such a stigma in Africa. The topic of depression, it's more like a fine line of insanity, that people, think you're crazy when you talk about such issues. Why do you think it's such a big stigma in Malawi after all these awareness programs that are happening and people trying to talk about it more? Why do you think it's such a huge stigma?
So actually, this stigma comes from the fact that people believe that somebody who is experiencing depression should be able to snap out of it. Okay, so they don't actually understand why you should have this low mood throughout, why you should not be interested in the things that you enjoy doing and things like that. Mental health, something that you cannot see or touch, as it were, many people are kind of a bit, they would say, okay, no, why don't you just really snap out of it? But it's not something that anyone could do that. So that's where I think the stigma comes in.
How can we help our family and friends, like our loved ones? If we think that maybe, okay, I have a friend who's maybe going through so much or could be leading towards depression, how can I take position and help this person?
Once somebody like family have noticed that somebody has actually changed in the way that they maybe behave, the way that they look at things, and the way that their mood is, then what is really crucial is that somebody who's depressed needs somebody who could actually sit with them and understand them. The main kind of treatments available, let's say where somebody is given medication, so antidepressants, and then we could also talk about talk therapy. Now, in terms of talk therapy, it's something that can be provided by a professional, people like maybe counselors or psychologists or psychiatrists. Now, these, like in Malawi, the problem is you find that in Malawi we have maybe around 3 psychiatrists only. Now, if you take 18 million people, it means that's around 6 million people for one psychiatrist, maybe 2 or 3 clinical psychologists, and that's also the same, like 18 million people, or maybe 6 million people for one kind of psychologist.
So on that note, is it possible to self-diagnose, like in terms of people who can't afford, or to see, is there other remedies rather that we could tell the public that they could take, or steps that, that could make them feel better if somebody maybe is in a very low situation? What could we say to that individual?
So basically I would say that if you look at the African context in terms of personhood, there is what is called Ubuntu or Umuntu, where we say that I am because we are, something like that, that we are a community. Now, sometimes in terms of depression, you find that people that are more or less like keeping to themselves and are kind of lonely are the ones that maybe would actually face more kind of problems around that. But where you have like a community set up, people that have got other people around them, like proper relationships, that's when actually it becomes a bit more like easier to deal with. But when talking about mental health, we are looking at a continuum from a situation where somebody could be 100% okay in terms of mental health, and the far end where somebody is completely kind of sick. But in many cases, when we talk about mental health, many people are actually within that continuum. So much that maybe we could say very few people are ever very healthy when it comes to mental health. There are always these little things.
Because people in Malawi and just Africa in general especially, I think we try to be so strong and not really, as you're saying, we need to talk, we need to this, but it's, as you said, we're afraid we'll look weak. Or if you're talking about maybe marital problems, it's more of a taboo to talk about, oh, my husband and I are having issues, or all sorts of things, right? So I want you to really emphasize the, let's say, the outcomes of what depression can do if you don't treat it. There's always a level of mental illness for everyone, but then maybe somebody now is approaching the brim of, maybe suicide, as you mentioned. Why should people take this seriously, and why is depression such a scary thing?
Yeah, actually you bring up a very important fact. So this is the body-mind relationship. So your mind, so in this case mental health, affects your physical health. So when you're depressed, you find that it will trigger a lot of systems in your body that are gonna respond, and then you have all these some kind of physical diseases. So like we are rightly putting it, depression or even stress. So you could take stress as more or less like a minor element of depression. That can actually show into some kind of bodily conditions. So these are what are called kind of psychosomatic conditions. So you would have, let's say, headaches, unexplainable in a sense. You would have major body aches and other things. So in essence, like you're saying, we need to really pay attention to mental health.
Social media is one of the now challenges, and we're having as well when it comes to exposing people and all that, but maybe there's a bigger problem behind some of this behavior. So what could you touch on that and say about that in terms of colleague weird behavior, family, or we see weird things but we don't address them, and they could be very vital?
So actually the whole issue around not paying attention to mental health actually comes to play in this case. So like the example that you're giving, you could have somebody behaving in a way that is kind of incongruent to what you expect them to do. Okay, so in this case, usually just think, okay, maybe they're mad or something is not good, and in this case in a negative way. But it could be that somebody has a mental health condition, a mental health disorder. It could be a personality disorder. Or in many cases, we don't want to be to go and disturb whatever's happening elsewhere. The message here would really be we should actually not step away or actually say, okay, I'm not going to be part of this. As human beings, we should actually look after one another.
Well, thank you so much, Erick, for coming here and touching on this subject and giving us, I think, light on this subject, and the public, I hope, will benefit from this topic, and we're going to keep having these discussions in the future.
Yeah, thank you very much.
We definitely are going to continue talking about on this show, because we want to raise more awareness. And if you feel like a loved one or you are feeling depressed, try to focus on being happy. Studies show that the more you laugh, the happier you feel. Okay, so that is it for our point blank talk on this episode. I was with Dr. Erick Omar.